Diabetes affects over 4% of the population, and that level is increasing. It can cause damage to the small blood vessels in the part of your eye called the retina. This damage is known as diabetic retinopathy, which is the leading cause of blindness in adults of working age. If diagnosed with diabetes, the National Diabetic Eye Screening Programme entitles those over the age of 12 to receive free annual screening. In the following series of short videos, I'm going to explain exactly how you can become involved in the screening programme. I'll be undergoing the screening process myself to demonstrate exactly what's involved, set out to answer any frequently asked questions, and resolve any worries that you might have.
Once someone's been identified as having diabetes by their GP, he or she will refer them to their local diabetic eye screening programme. They'll be contacted by letter, offering them an opportunity to attend screening at a venue, date and time of their choice.
Of course, the service is completely free of charge, so people really should attend.
Absolutely. It's a fairly straightforward process, and it has a major impact upon helping reduce sight loss.
The diabetic eye screening process can be carried out at a variety of localities: hospitals, high street optometrists, community healthcare practices, such as the GP surgery where I am today. If I were attending for the first time, how would the appointment proceed?
Well, the first thing would be for me to introduce myself. So, my name's Pete, I'll be doing your eye test for you today. And then I would ask you to confirm your name, your date of birth and your address, just to make sure that we've got the right person in from the waiting room. Then I would ask you whether it's the first time that you've been for this test. If it was your first time, I'd just briefly explain what we'll be doing today, what the test involves, and if you have any questions at all about the test. And then once we've established that you're happy with what we're doing, I would just ask for your consent for us to continue with the eye test, and then I would follow on with some questions.
Can you be clear about what sort of questions?
Just general questions to do with your diabetes, about the history of your diabetes, how it's controlled, also about the drops that we'll be putting in your eyes to dilate your pupils, and a little bit of history about your eyes.
Well, it all sounds good so far. Fine, you've established my history and I've answered your questions, so what next?
The next stage is to have an eye test so that we can establish how well you can see.
Oh, well, I go to my optician every year for a checkup, so why do I need another test today?
Well, this test is quite specific to do with what we're testing for, so it's important for us to measure your sight, as it may have a bearing on the final outcome of the results.
Oh, I see. Let's do the test.
Okay. First of all, can I ask, do you wear glasses at all for distance, for driving or television? No. Okay. If you take that with your right hand, hold that up over the bridge of your nose like a mask, and there's an eye chart just ahead of you. If you stare at the eye chart and then looking with your right eye, starting from the top of the chart, just work your way down, reading out the letters for me.
Okay. COHZB, No, that's it.
Good. And then if you turn the mask all the way around, so hold it with your other hand so that you're looking through your left eye, and then do exactly the same again for me. So again, starting from the top of the chart, just work your way down.
COHZB, ZFRN, that's it.
No, that's good. And then if I just take that back off you for a moment, and we're going to see whether you can get a little bit lower down the chart, looking through the pinholes this time. So again, hold that thing up over the bridge of your nose, right eye, and again, starting from the top of the chart, just work your way down.
Okay. COHZB, CZHKSCRZSX.
Good.
Back to the end.
And then turn it around the other way again.
That's amazing.
So that's it, up to your left eye, and then the same again for me, starting from the top of the chart.
COHZB, SSX, ORX, but there's the last line.
Good. Excellent. Well done. Thank you very much.
Thank you. Does that mean I don't need another eye test at my optician this year?
Oh no, we'd certainly still recommend that you have regular tests at the optician. This test is specifically to do with the test that we're doing for diabetes, but when you go to the optician, they'll give you a thorough eye test to test for glasses, so it's still important that you go.
Oh, I see.
Now that we've established through the eye test how well you can see, we now need to prepare your eyes for the photography, and we do that by administering some eye drops into each eye.
Well, what are the eye drops for? Do I really need them?
What the eye drops do, they enlarge and fixate the pupil, and that allows us with our specialist camera to get a good clear photograph of the back of each eye.
Well, I understand why they're necessary, but some people still might feel uncomfortable about having eye drops. So what would the eyes feel like after the eye drops have been administered, and are there any side effects?
Side effects with these particular drops are extremely rare. There is a leaflet there that we hand out. That gives you a little bit more information about what to do in the unlikely event that you were to have an adverse reaction. But for the vast majority of people, it's just a case of when the drops first go in, you'll get a slight stinging sensation, probably for about 20 seconds or so, a bit like getting shampoo in your eyes. That'll wear off quickly. After about 5 minutes, you'll probably find that your eyes become more sensitive to light, and also your vision will become more blurry. So of course you mustn't drive.
Well, why shouldn't I drive?
Well, if you've got blurry vision and sensitivity to light, that will affect whether you can drive safely and even possibly legally. So if you have driven to the appointment, you must ask somebody else to drive back if you've got somebody with you.
Oh, I do understand now.
Okay, so we're just going to put these drops in your eyes for you to dilate your pupils. Let me give you a tissue. There we are, if you hold on to that. And then all I need you to do, if you tilt your head back and have a look up at the ceiling, I'm just going to drop down your bottom eyelid, and you just got a couple of drops in that one. That's it. And then over to your other eye, and again just a couple of drops in that one. Now that'll probably sting a little bit.
Yes, as you say, it is stinging a bit.
Well, that's quite normal, and that should wear off within about 20 seconds or so.
Yes, it's better already.
Good, there we are, that didn't take long. Now what we need to do now, the drops take about 20 minutes to work, so if you'd like to take a seat back in the waiting room, I'll pop out periodically just to check to make sure you're okay, and then in about 20 minutes we'll bring you back in to do the photography for you.
Fine, thank you.
Okay, good. And how do your eyes feel?
Well, slightly blurred, but it's not uncomfortable. I'm fine, really.
Okay, let's have a look. Yeah, they certainly look well dilated, so I think you're ready for the photography now.
And what's going to happen?
Well, what we're going to do is ask you to sit in front of the camera, and I'm going to attempt to take 2 views of the back of each eye, 2 standard views. All I need you to do is just follow a target. You'll notice a bright flash when the camera fires, so that might just blur your vision for a few seconds.
Right, I'm ready.
Good, okay. So just to reiterate, we're just going to take 2 views of each eye. Let me just wheel the camera up nice and close to you. And then all I need you to do is lean forward and put your chin on the rest, and just bring your head forward so that your head's touching the bar at the top, nice and tight. How does that feel? Is that comfortable?
Fine.
Good. Now, all I need you to do is look directly ahead, and you should see a little orange light. If you stare at that orange light for me, it's going to change to a green one just outside the camera. That's it, that's perfect. Keep watching that little green one and hold that nice and steady. Both eyes nice and wide for me. Lovely, that's one done. And still on the same eye, you're back again with the orange light. And now the little green one again. So again, just keep watching that little green light, and it's going to move away to the left of the camera. So follow it all the way across. That's it, that's lovely. And again, both eyes nice and wide, hold that nice and steady. Perfect. Okay, so that's that eye done. I'm going to move over to your left eye now. And we'll do the same again. So starting with the little orange light. That's it. And again, both eyes nice and wide, and just stare at that little light. There we are, back to the little green one. Keep your eyes on the green one. Good. And then once again, back again with the orange light. And the little green, or it might be a purple one now, moving away to the right of the camera. So just follow that all the way across. Hold that nice and steady for me. Super. There we are. And that's all the photographs taken for you. Well done. You can sit back and relax now, and we can have a look at what we've got.
That looks interesting.
Yes, that's what the back of your eye looks like. We take 2 views of the back of each eye, which is the requirement of the National Screening Programme. We take 2 of your right eye, and then 2 images of the back of your left eye.
What's that white blob in the middle?
Oh, we can enlarge that up and take a look. Let's see. So we'll enlarge that up to fill the screen. There we are. So this bit is the optic nerve. So that's the link between the eye and the brain. And then the dark patch in the middle is the macula, so that's where all your central and your detail vision is. And then you've also got all the blood vessels that come in on the back of the optic nerve which feed the eye, which feed the retina. Do you have any questions?
Well, when will I receive the results of my test?
Well, what happens now is these images are saved securely onto our database, and they go away to our grading centre where they're assessed, where we look for any diabetic damage to the back of the eye. And then when we have a result, we send a letter to yourself and another one off to your GP, which you should get within the next 3 to 6 weeks. And then that will also tell you when you're due to come back and have another eye screening.
So we've completed the test now?
We have, yes, we're all done for today.
Excellent, thank you so much.
Thank you.
So, leading up to this point, your GP has made a referral to your local diabetic eye screening programme. You've been offered an appointment by letter. The screening process takes about 45 minutes, during which your history has been established, you've had a visual acuity test, your eyes were dilated using eye drops, and the photographs have been taken for grading. Please remember that your eyes will be susceptible to bright light and possibly a little blurred. So bring sunglasses with you and do not attempt to drive for the following 6 hours. We know that diabetes is the leading cause of blindness in adults of working age, and you see me go through the screening process. But what happens next? I'm in a grading centre in Worcester. Craig, can you explain what we're looking for here?
We're looking for signs that may be related to diabetes that may cause trouble to the back of the eyes.
And what do some of those signs look like?
The first sign of any diabetic retinopathy would be small red dots on the back of the eye, which could then obviously lead to further problems, i.e. hemorrhages and also leakages that could affect the sight.
Can you show me what you mean?
Yes, of course. This is an image that I have showing background retinopathy, which is the very first start. As you can see, these little red dots on the back of the eye. And then I've pulled up an image here of a much more advanced retinopathy, which could potentially be quite sight-threatening.
This looks very detailed and technical. How can you be sure that the grading is as accurate as possible?
All images that are taken are graded at least once, and a good proportion of them are then secondary graded for quality assurance. This will just make sure that the patient gets the right outcome.
How can you reduce the risk of developing diabetic retinopathy, which could cause blindness?
Good control of your diabetes is the main key here. Regular checks with your GP, reducing blood pressure, and also giving up smoking, and just generally leading a more healthier lifestyle.
The National Diabetic Eye Screening Programme requires that results from the screening process be notified both to you and your GP within 3 to 6 weeks. The results will come in a letter, and as well as highlighting the results of your test, it will also explain exactly what they mean.
Majority of the time, no further action will be required. The patient will be recalled for an annual checkup. In some cases, patients may be recalled for further screening. It's nothing to worry about. This is normally because the photographs are not sufficiently clear and the patient may need to be referred for an alternative form of screening. Occasionally, screening may pick up on a number of changes at the back of the eye that may need to be referred to the hospital eye department for further assessment and treatment if needed.
And this will be made clear in the letter?
That yes, the patient will be fully informed.
What I've learned is that annual screening, good control of your diabetes, combined with a healthy lifestyle, can reduce the risk of developing diabetic retinopathy. This is essential to minimise the risk of sight loss. The National Diabetic Eye Screening Programme is completely free of charge. It's available to anyone over the age of 12 who has been diagnosed with diabetes. I found the whole process friendly, thorough and supportive, and would encourage anyone who has diabetes to attend an annual screening test.